Dr. Wood.
And this is just more of a comment. If the plan is going to make a payment, and the patient has decided that they've consciously decided they want to go outside the network, at that point, isn't it the patient's money, and shouldn't the patient's wishes be honored at that point to directly pay the physician? That's the fundamental question for me.
And I think it's a fair question. The way it works, so I had an out-of-network procedure myself, and I wanted to go to a physician who was not in the Blue Shield network. And the way it worked was I sat down with that physician. It was clear how much I was going to have to pay on my own. I made an agreement to pay that with that physician. I got a check from Blue Shield like a month or so later for whatever piece they were going to pay. But I had already negotiated directly with the doctor what I was going to pay, and I had to pay it financially myself. That was part of the bargain I negotiated on my own behalf because I went out of network. Because remember, Blue Shield had no contract with that physician. They aren't negotiating on your behalf in that situation. So I did that through my own course, and yes, it would have been maybe more convenient to have Blue Shield send the check in directly to the doctor, but it wasn't an impediment to care. I knew I was going to get the check from Blue Shield, and I knew what I owed the doctor. So what we're saying here is the tool that we have from a negotiating perspective, right, with physicians to get that payment directly from Blue Shield or Blue Cross or whatever health plan is an important negotiating tool. It's a reason to become a contracted doctor. And we don't want you to take away reasons for doctors to join our networks. We want to encourage doctors to join our networks, and this is a substantial value that they get, is to get paid directly from Blue Shield. And in return for that, they are usually agreeing to lower rates, which means lower premiums. They're agreeing to not balance bill our members, and they're agreeing to high quality scores.
Additional witnesses or additional questions from committee members? Okay, seeing none. The committee can entertain a motion. Assemblymember Dubovny.
I'll wait for the motion to make a closing statement.
Okay. The committee can entertain a motion. We have a motion from Dr. Wood. Second? Second from present committee members? I second the motion. We have a motion. We have a second. Assemblymember Dubovny, would you like to close?
I think Mr. Wiedemann made a very powerful argument. Mr. Wiedemann's obviously in a very high income bracket. He decided he wanted to see an out-of-network doctor. That's why we have PPOs. We have PPOs to give patients the opportunity when they're facing a small surgery or a life and death choice for medical attention, that if they need to see an out-of-network provider, they have that opportunity. He was able to do so where out-of-network costs would not affect his family. They wouldn't affect his family to pay out of pocket up front. For many people in my district and across our state, they do not have that luxury to pay up front, to wait several months to get a reimbursement check. We all want to see access and affordability of health care expand in our state. I don't think anyone that spoke from this podium today would say otherwise. But what are we really talking about today? If there is no need for ever having out-of-network care, why would we offer PPOs? Why wouldn't we just have HMOs? Why would there be such a fight over who regulates the different healthcare plans in our state? Clearly there's a necessity to have an ability to see an out-of-network doctor to ensure that you can protect your quality of life and in some unfortunate situations be able to keep your life. I think it's very reasonable to ask the insurance companies to allow patients to opt in to have the billing sent directly to them. These patients could be suffering from cancer, Lou Gehrig's, Alzheimer. These could be children And to serve as a middleman between the insurance companies and the providers is not a situation that these patients and their families often want to deal with when their only goal is to get better and regain their quality of life. This is obviously a difficult decision, and most decisions on this committee are. We're all struggling to make sure we strike the right balance. I will say, in response to the consumer advocate groups, I appreciate their work. I appreciate their comments today. I appreciate their suggestions. We took many of their amendments, which I do believe improve this bill. The group that spoke before you fundamentally does not believe PPOs should exist in the marketplace. I don't think I could have ever won their support. So the opposition of this bill today are the insurance companies, which provide a service in our community that is valuable and worthy, and I continue to work with them even on other bills as we are on opposite sides on this one. I believe that PPOs have a valuable place in our market. Several years ago, I had a personal situation where a dear friend was struggling with breast cancer. She needed to see an out-of-network doctor. Her insurance company provided resources for her that she felt were very above normal standards, but she still felt the need to see a doctor out of her network. She was wealthy. She was able to do so. She was able to pay out of pocket. It did not impact her finances. Many are not that lucky. While this is a complicated situation, I ask for this committee to vote this bill out today to allow us to continue to work with insurance companies, the doctors, the consumer advocacy groups, and hopefully many on this committee who would like to add their voice to this discussion. I'm not here to make any statements against insurance companies and PPO products, but simply say be a voice for those constituents in our district that have PPOs that might need to see an out-of-network doctor to help ensure their quality of life or perhaps save their life. And with that, I respectfully ask your aye vote.
Thank you, Assemblymember DeBobney. I just want to recognize and thank the author and the sponsors for taking so many amendments up to this point in the process, particularly amendments that have built in better consumer protections into the bill. And there have been similar iterations of this bill in the past, and at this stage in the process, this bill has taken more amendments than any of the prior iterations. So I just want to thank you for that. And as we've heard, there's still a passionate debate on this issue. We're in the first House and the first Policy Committee. So I want to encourage you to continue to work with the opposition on outstanding issues. And I want to thank you for getting the bill this far along this soon, and for keeping an eye on those consumer protections in the bill. I think this is a discussion that needs to continue and should continue. And so with that, I'm recommending an aye from committee members on this bill. And we have a motion and a second to pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? No. Mainshine, no. Bonilla? Aye. Bonilla, aye. Burke? Chavez? No. Chavez, no. Chu? Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, no. Ridley Thomas? Rodriguez? Santiago? Steinnorth? Thurmond? Aye. Thurmond, aye. Waldron? Wood? Wood, aye.
Current count is 5-3. The bill is on call. Assemblymember Stone. File item number 13, AB 848.
Thank you, Mr. Chair and members. This bill is about licensed residential care facilities, and in their license that they get from the state in order to provide treatment, they are not allowed to provide medical services on site. So when one of the patients who's there for drug rehabilitation or other treatment needs medical care, they need to be taken off-site to their provider, then brought back on-site, which is disruptive not very efficient, and not very effective. What this bill would do is, under their license from the state, be allowed to provide medical coverage or bring medical providers onto the site of the residential care facility to provide the treatment. This is most likely going to be seen as a house call by doctors who come in, and this is only for licensed care facilities that want to be able to do this. And under the scheme that's provided here, we're actually asking DHS to provide a structure and some rules around the provision of medical services on site. And this bill does really nothing more than that. And with that, I respectfully request your aye vote. I do have some folks here in support to talk about the impacts that not being able to provide medical services on site has.
Thank you. Thank you for the opportunity. Okay. Thanks for the opportunity to address this issue. My name is Rod Libby. I'm Executive Director of Janus of Santa Cruz, a substance use disorder treatment facility. When people come into substance abuse treatment, we assess them for level of care to find out how acute they are and what level of care they need to be in. We use an ASM assessment, American Society of Addiction Medicine assessment, which is a evidence-based best practice. And people fall into one of three categories. If they've had fairly short-term and not too extensive an alcohol or other drug dependency and don't have any other medical issues, they can be treated on an outpatient basis or in any sort of non-medical social model type program. On the other end of the spectrum, if they have had a fairly complex history of substance use, other behavioral disorders, and other medical problems, they might make a level of care for inpatient, which means they'd be in a hospital-based program where they get medical care. But about 80% of the people who present fall into a category of subacute treatment, and these are people who have a fairly complex history of substance use, but they also have other medical disorders like diabetes, high blood pressure, are very common, obesity, and they may have some instances of heart seizures and those kinds of things. And they need detox medications and they need medical oversight while they're in treatment. Currently, we're not allowed to do that. This is 80% of the population that presents we're not able to treat under the current regulations. This bill would allow us to have the physician and medical oversight that we need to treat these people. Thank you.
Hi. Chairman and members of the committee, thank you for the opportunity to testify before you today. I am Dr. Angela Barr. I'm a physician practicing here in Sacramento, specializing in the treatment of the disease of addiction. I'm here representing the California Society of Addiction Medicine, a state organization of physicians who treat substance use disorders. CSAM is a co-sponsor of Assembly Bill 848 that will finally make it clear that licensed physicians may provide appropriate medical services to persons undergoing withdrawal and treatment in residential treatment facilities. What we now know about addiction treatment is effective, safe treatment combines medical stabilization with appropriate medical care and intense social behavioral therapies. I urge your support for this bill. As a fellow trained addictionist, I intimately understand that patients get well when they have immediate access to medical services with a strong program stressing structure, education, and behavioral change. The latter part of this effective treatment model is available in licensed residential facilities. However, current state law precludes the essential and often initial component of medical care necessary for successful addiction treatment for many residents. On-site medical care by a licensed physician of residential facility would provide immediate assessment and stabilization to eliminate disruption in treatment. When a residential facility client has medical needs during the course of treatment, the facility staff must send them to a doctor's office or hospital emergency department. This is not only inefficient and costly, it can sometimes be dangerous. It is dangerous for a heroin user IV site riddled with abscess and or other skin infection to not be immediately recognized and addressed at the treatment facility admitting them for treatment. The current state statute limits proper care of clients who are seeking addiction treatment, including proper psychiatric assessment and treatment, as well as to provide symptomatic relief of withdrawal to alcohol and other drugs. Assembly Bill 848 takes a positive step to lift the ban by updating the law to allow residential treatment facilities to provide limited medical services under state supervision. We urge your aye vote on this bill to allow medical care by physicians to persons undergoing withdrawal in residential facilities. We ask this of you because we know that this medical care is an integral part of successful treatment, and lives will be saved as a result.
Additional witnesses in support?
Thank you. Tom Renfrey with the California Behavioral Health Directors Association of California in support.
Steve Carlson for Elements Behavioral Health Operators of Promises Treatment Centers in support.
Jim Gross on behalf of Valkyrie of Medication for the Treatment of Opiate and Alcohol Addiction in support.
Sylvia Solis-Shaw on behalf of the City and County of San Francisco and the Office of Mayor Ed Lee in support.
Thank you. Witnesses in opposition? Seeing none. Questions from committee members? Seeing none. We have a motion. We have a second. Assemblymember Stone, would you like to close?
Ask for your aye vote.
Thank you, Assemblymember. We have a motion of due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Aye. Bonilla, aye. Burke? Chavez? Aye. Chavez, aye. Chu? Gomez? Gonzalez? Aye. Gonzalez, aye. Hernandez? Aye. Hernandez, aye. Lackey? Nazarian? Patterson? Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Thurmond? Aye. Thurmond, aye. Waldron? Wood? Aye. Wood, aye.
Lackey's an aye.
Lackey, aye. 10-0.
The count is 10-0. Your bill is out. Congratulations to Assemblymember Stone.
Thank you. Thank you.
Next, we have item numbers 4 and 8 by Assemblymember Hernandez, AB 253 and AB 430. Would you like to start with AB 253, Assemblymember Hernandez?
Yes, Mr. Chair.
Okay, thank you.
All right, thank you for that. Appreciate that very much. Members, Assembly Bill 253 is a simple bill that attempts to strengthen the expertise of Mental Health Service Oversight and Accountability Commission and bolster the link between bond funds that can be used for constructing housing for veterans and service dollars that can assist in providing services for veterans in those supportive housing projects. My bill adds 2 additional members to the Mental Health Service Oversight and Accountability Commission to include a veteran with knowledge about veterans' mental health issues and a person with knowledge and experience in reducing mental health disparities. Doing so will help tackle these challenges in these communities. I will be accepting the committee's amendment to require the Department of Health Care Services, DHCS, to post the county's mental health cultural competency plans on a dedicated website and notify the legislature. The importance of making sure mental health services and outreach are available to underserved communities continues to be a challenge at the local level. The information from the California Reducing Disparities Project indicates communities are not receiving culturally appropriate services. In fact, in some instances, they are not being reached out at all because they might require different approaches to bring them into the system. AB 253 also requires the departments administering Proposition 41 to give a preference to applicants when the applicant can demonstrate a multi-year commitment of Proposition 63 funding for mental health services. Doing so will help leverage funding to help veterans who need services. We will continue to outreach to departments to address any concerns. Many of us speak about how much we want to help our veterans, and I know that all of us are grateful for their service. AB 253 is an opportunity for the legislature to make it easier to help and assist our veterans. Here with me to speak in support of AB 253 are Pete Conity, Lieutenant Colonel, Pete Conity and Associates, and Stacy Iramato, Director of the Racial and Ethnic Mental Health Disparities Coalition.
Mr. Chairman, members, Pete Conity representing the veterans groups listed on your analysis. When this bill went through housing, they kind of woke us up that it appeared that veterans needed to pay more attention to this issue. Veterans were not included in Prop 63 because the community was not that organized in 2004. But the veterans community is responsible for passing Proposition 41. That is a dedicated bond act to help veterans. However, it appears that the housing community is trying to treat this just like as a normal, another housing project, and not getting people that are competent and agencies to assist veterans. This is a really pretty simple, straightforward, common sense measure. The federal government has promised to end veterans' homelessness by 2016. The mayor of LA has said he will end homelessness by 2016. The mayor of San Francisco has said he will end veterans' homelessness by 2016. And it's not going to happen. You may move them into the houses, but they're not going to stay there because 25% of all the homeless are veterans, and they've got to have competent, supportive services for mental health. And the mental health community has stepped up to the plate and are working with the veterans groups to do this. So we would respectfully urge your aye vote on this measure.
Thank you. Additional witnesses in support.
Hi, Stacy Hiramoto, Director of REMCO, the Racial and Ethnic Mental Health Disparities Coalition. REMCO is proud to be a co-sponsor of this bill and consider it a legislative priority for us this year. REMCO members represent underserved racial, ethnic, and cultural communities all around the state. Some of our members include leaders of the California Reducing Disparities Project, including the African American Health Institute of San Bernardino, the Native American Health Center, Latino Coalition for a Healthy California, and Community Health for Asian Americans. Representatives from the Muslim community, the Armenian community, and others are active REMCO members. This bill adds a seat for an expert in reducing disparities on the Mental Health Services Oversight and Accountability Commission. REMCO has been attending meetings of the OAC on a regular basis since our formation in 2007. We strongly believe that there is not enough attention given to the issues of cultural competence and reducing disparities. Very few, if any, evaluations of the Mental Health Services Act have paid attention to whether racial, ethnic, or cultural communities are being served adequately. A commission member who will champion and ensure the issues related to cultural competence and reducing disparities is crucial, in our opinion, to change this situation. The reason we want the bill to address the County Cultural Competence Plan requirements is similar. We want attention paid to these valuable reports. These reports require from each county were actually an excellent way for the state and for everyone, including state and local advocates, to assist counties in making progress on reducing disparities. Unfortunately, these reports were suspended when Prop 63 passed in 2005 because the county said they were too busy to do them. The reprieve lasted 5 years, and the last time they were turned in was in 2010. Although the State Department of Mental Health was supposed to score these and post the results, the governor reorganized the department, and the duty of reviewing and scoring the cultural competence plans went to the Department of Healthcare Services. The scoring of these 2010 reports was never completed, and now the state and counties have determined that they are too old to be of use. This again is evidence of issues around cultural competence and reducing disparities in the mental health system not being a priority. Attention needs to be paid to these reports, and while REMCO does not object to the amendment requiring DHCS to post the report and scores, we believe that requiring the scores of all the plans to be sent to the legislature is a better idea. Again, REMCO considers this the most important legislation this year in an effort to reduce mental health disparities. Thank you.
Additional witnesses in support.
This is Chuck Helgett, representing the California Association of Veteran Services Agencies, in support.
Lorraine Ploss, State Legislative Chairwoman for American Veterans. We support this.
Maggie Merritt, on behalf of the Steinberg Institute. Housing and homelessness and the plight of veterans is a chief concern of ours. We're co-sponsors of this bill, and we ask for your aye vote.
Rebecca Gonzalez, National Association of Social Workers California Chapter, in strong support.
Beatrice Lee, President of REMCO and also Executive Director of Diversity and Health Training Institute.
Laurel Ben Hamida, Steering Committee of REMCO, Muslim American, in strong support.
Thank you. Witnesses in opposition. Seeing none. Questions from committee members. Assemblymember Ridley Thomas.
Very brief comment. Thank you, Mr. Hernandez, for bringing this bill forward. As chair of the Select Committee on Mental and Behavioral Health, I've attempted to delve deeply into the issue of veterans homelessness. In Los Angeles alone, to end veterans homelessness in the city of Los Angeles, we have to house roughly 650 veterans a month. And it's a pretty tall order. There's an affordable housing challenge, but services are a key part of that. And this bill, the reason I moved it, and I'm very supportive of it and thankful for the Steinberg Institute's work with you on it, is because this bill is going to help bring state resources to bear in a critically underserved community with respect to our veterans population. This will help save lives and improve the quality of life in the greater Los Angeles areas, and I suspect across the state. So thank you for this bill and your dedicated and steadfast leadership.
Thank you.
Questions from committee members? Seeing none. We have a motion. We have a second. The motion is due pass as amended to appropriations. Assemblymember Hernandez, would you like to close?
If I may use Mr. Ridley Thomas's comments as my close, I ask for aye vote.
Thank you. You may. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Chavez? Aye. Chavez, aye. Chu? Gomez? Gonzalez? Hernandez?
Aye.
Hernandez, aye. Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Thurmond? Waldron? Wood? Wood, aye.
Your count is 9-0. You need one more to get out. We will leave it on call. Thank you, Assemblymember Hernandez. You can present on your next bill whenever you're ready.
Thank you, Mr. Chair and members. Assembly Bill 430 is my next bill. It creates a new standard for the California Emergency Medical Services Authority,
Move the bill.
known as EMSA. Thank you. Certification by requiring local emergency medical service agencies to commission a comprehensive assessment of their regional trauma system at least once every 5 years. This independent assessment would benefit EMS systems statewide. This bill is necessary to respond to the state auditor's report suggesting the need for better oversight in the spending and allocation of Los Angeles County Measure B funds. This bill also requires that EMSA develop a statewide trauma plan to address all aspects of trauma care system and report to the legislature the status of the development or implementation of the statewide trauma plan. A state audit report that I requested concluded that LA County lacks a comprehensive assessment of its trauma system. The county has not demonstrated it has addressed the most pressing trauma needs in the area. This is evidenced by the appropriation of trauma system funds from the 2011-2012 fiscal year, where approximately 20% of funds were collected from the San Gabriel Valley in LA County, but only 1% were returned. This is not just a problem in LA County. The gap which exists across our state in service areas means that transport times could range from minutes to hours, which could be the difference of life or death for a person. It is important that we as a state are prepared with an organized trauma system ready to give seamless and effective care of patients across county boundaries. Specifically, AB 430 requires a local EMS agency to commission a comprehensive regional assessment of equitability and access to its trauma system, and to establish an oversight committee for the purpose of assisting and investigating the feasibility of health facilities in underserved areas serving as a trauma facility within the trauma care system. I am committed to working with all stakeholders to ensure that AB 430 provides accurate and important fixes to the coordination of California's trauma care system. I want to let the committee know that the state auditor staff is here. If any member has any technical questions, I respectfully ask for your aye vote.
Witnesses in support. Okay, seeing none, witnesses in opposition.
Good afternoon, Chair, members. Betsy Armstrong on behalf of the EMS Administrators Association and the Emergency Medical Directors Association, and I've also been asked to weigh in on behalf of the California State Association of Counties in opposition. Essentially, our local EMS agencies currently perform objective trauma system planning and evaluation based on the local needs of their communities. And this is done with the oversight of both the State EMS Authority as well as the EMS Commission. In particular, our administrators and their medical directors object to the requirements in AB 40 on our local LEMSAs to commission a regional assessment of their local trauma systems. And in particular, they are extremely concerned about the use of the regional trauma coordinating committees in this process. Our TCCs, as they're known, are voluntary and formal in nature and not equipped to carry out the functions AB 430 assigns them. Furthermore, our folks believe that it's wholly inappropriate for the RTC recommendations to be incorporated into their local trauma system plans. For these reasons, we oppose the bill. However, we pledge to work with the author and his staff to address our concerns. Thank you.
Additional witnesses in opposition? Seeing none. Questions from committee members? Assemblymember Ridley. Wait. Okay. One more witness in opposition. Excuse me, Assemblymember Ridley Thomas.
Apologies. Sylvia Solis Shaw on behalf of San Joaquin County. We believe that it would negatively impact the authority and governing role of the county and our EMS agency to oversee the EMS system in the county. So we oppose. We also believe it's an unfunded state mandate and would require a minimum of $65,000 every 5 years, and the increase in EMS staff costs could surpass $100,000 a year. So for those reasons, we're in opposition.
Thank you. Assemblymember Ridley Thomas.
Yes, to the opponent representing the three organizations, or two, and then speaking on behalf of CSAC. In absence of this bill, what are your clients doing to figure out what our trauma needs are and how we fill those gaps?
They currently work with all of the stakeholders within their communities to assess their systems. I think specifically what they're opposed to is this concept of this regionalization. They do consult with the RTCCs, but again, I think our folks feel that they are doing the job at the local level to address the needs of their specific communities.
Do you have specific amendments that you are suggesting to Mr. Hernandez, or is it philosophical? Or are you not?
I think we're willing to work with them to get to a place.
So you don't have anything yet, but you have concerns?
I think specifically the RTCC language would have to come out.
Well, thank you. Mr. Hernandez, I represent an area that has a dearth of trauma centers, a portion of an area, and anywhere around Los Angeles County, Southern California, if one of us is in a traumatic accident, we may be in an underserved area that has a paucity of trauma services. So this seems like an important step. I don't know that there's, frankly, any particular system other than audits where we find out what our trauma needs are. There's anecdotal evidence, but there may be federal information. But I don't know if there were a lawsuit, for example, about the coverage and care. I think trauma would be one of the big things that we had a dearth of. So it's a good bill in concept. Hopefully we can get some more tangible, concrete things that we can contribute to the dialogue. There may be existing structures. There may be old reports that we can synthesize. I read the audit, I think it was last year, so there may be things in there, but as one who's in a county where we just approved, you may have heard earlier that we just approved the Pomona money, and we're trying to get in Spot 6 of LA County, which is where King Hospital used to be a full-service level 1 trauma center, back rolling, that we would hope to see a very thoughtful conversation. And regionalization is already, we use regionalization in everything in large governmental entities, so I'm not exactly sure if I understand. Maybe it's because it's late in the evening, but I'm not sure what the problem is. So I'll be supporting this bill and hope that we can continue with a concrete conversation about how we improve the trauma care system in our state. Thank you, Mr. Chair.
Dr. Wood.
Yes, I want to thank the author and the co-author for bringing this forward. As someone who's actually served in disaster sites where there have been huge amount of trauma and casualties, the value of a regional approach, I think, is very, very important. I appreciate that individual communities might be doing things really, really well, but the reality is when something really bad happens, a regional approach makes a whole lot more sense. So I know that this is a work in progress, but I encourage you to continue working with folks. I think you're really headed in the right direction, and I hope that we don't get to experience a major incident at some point. But I hope if we actually do, that we'll be prepared to handle it. So thank you for your efforts.
Thank you very much.
Assemblymember Bonilla.
I remember this bill, I think, from last year, the year before, and I would be more comfortable if it was just applying to where the problem was, which I think is in your region. I come from a county board of supervisors. If I was a county supervisor, I would not like this bill, and I would not support this bill. I know, but it's true. Anyway, I think if you narrow it down, it would be much better. I'm debating now what to do about this. I went in the natural. Now, pouting doesn't work. It's not going to get my vote. But I think that, I'm not sure if I'm hearing from the counties that they're willing to let this one go and keep working on it, or, is this a hard no for...
We commit to work with the author.
Okay, well, I'll vote now, and if the working out doesn't happen, then I won't be voting on it later.
That's fair.
Thanks.
Assemblymember Rodriguez.
Yes, first of all, I want to thank the Assemblymember for his efforts to help provide a way to maintain and expand trauma care systems throughout California. It's vital in many regions. As our district back down in Southern California, we had a trauma care facility over 20 years ago, but due to issues financially, they shut down. And seeing that impact once it shut down until fast forward to now, where the closest trauma center is over 30-minute transport time. That's if you're lucky, depending on traffic and weather and all those things. So I don't think maybe sometimes we don't take in consideration a lot of things that are out there that prevent us from having more trauma care facilities out here. If you're a victim that needed those services, we'd be thankful of the services that we have through that trauma care system network and the ways we can expand them and have the accessibility throughout all Californians throughout California. It's greatly needed. So once again, I want to thank the author for bringing it forward. Look forward to work with you, and also as a co-author with that. Thank you very much for bringing this bill forward. Thank you.
Thank you.
Assemblymember Patterson.
Mr. Hennis, again, thank you for bringing it forward. I just echo some of the concerns of Member Bonilla. I am going to vote for this. Look, I come from Fresno County. The CSAC has had opposition. The rural counties have had some opposition. I think I do agree with Member Wood that I do think that regionalization on emergency kinds of things like this is really, really very important. Emergencies don't know where the county boundaries start and end. I appreciate the fact that you're willing to work as this goes forward, and so I'll be a vote for it.
Thank you.
Seeing no more questions or comments from committee members, we have a motion. We have a second. The motion is due pass to appropriations. Assemblymember Hernandez, would you like to close?
Just to give some ease to the members and the concerns and questions, a couple of years back I presented a similar bill before the state auditor, Lane Howell, had actually conducted the study. Her study revealed that the concerns are real, and she also suggested in her recommendations that her recos should apply to a statewide approach, a regional approach. And this is why we feel very confident bringing it forward here today. So I'm pleased to have your support if I can continue this dialogue and this work. I ask for your aye vote.
Thank you. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Chavez? Chavez, no. Chu? Gomez? Gonzalez? Gonzalez, aye. Hernandez?
Aye.
Hernandez, aye. Lackey? Lackey, aye. Nazarian? Patterson? Patterson, I. Ridley Thomas. Ridley Thomas, I. Rodriguez. Rodriguez, I. Santiago. Santiago, I. Stein North. Thurmond. Thurmond, I. Waldron. Waldron, I. Wood. Wood, I.
It's about 12-1.
Count as 12-1. Your bill is out. Congratulations, Assemblymember Hernandez.
Thank you, members. Appreciate it.
Next, we are taking file item number 20, AB 1102, Assemblymember Santiago.